Assalamu alaikum everyone. I hope all of you are doing well. In this video I am going to talk about an iron deficiency anemia. As all of you know that the heme require iron for its synthesis, so when there is decreased iron there will be defective heme synthesis. So going to the causes of iron deficiency anemia. The causes of iron deficiency anemia are divided into four. One is decreased intake, impaired absorption, increased requirement, and chronic blood loss. So the iron is not synthesized by the human body, it should be taken from outside. So when there is decreased intake of iron, it will result into iron deficiency anemia. So decreased intake may be dietary lack, it may be due to poverty, it may be due to infants, and it may be due to elderly. So the second cause of the iron deficiency anemia is impaired absorption. If a patient is taking adequate amount of iron but there is impaired absorption in the gut, so it will result into iron deficiency anemia. The impaired absorption include the steatorrhea, the celiac sprui, the tropical sprui, Whipple's disease. So these are the condition which result into defective absorption of iron. The Crohn's disease, the TB intestine, the chronic diarrhea, gastrectomy, duodenal surgery, and duodenal resection. These are the conditions which lead to impaired absorption of iron. The third cause of the iron deficiency anemia is increased requirement. There are some conditions in which the need for the iron become increased. These include the growing infants and children. They require more amount of iron. Pregnant female and premenopausal women, they require more amount of iron. The fourth cause of the iron deficiency anemia is the chronic blood loss. The blood may be lost from gastrointestinal tract, it may be lost from urinary tract or genital tract, and it may be lost from respiratory tract. Condition in which the blood is lost from the gastrointestinal tract, these include the peptic ulcer, the gastric cancers, the hemorrhoids, and the ankylostoma duodenale. So these are the various causes of the iron deficiency anemia. Going to the clinical features of the iron deficiency anemia. The clinical features include the non-specific symptoms, which include the chest pain, the dyspnea, the fatigue, palpitation, breathlessness, weakness, and irritability. So these are the symptoms which appear in all type of anemia. The other symptoms include the pharyngeal or esophageal web, which cause dysphagia. So some specific symptoms related to the iron deficiency anemia include the Peterson-Kelly or the Plummer-Vinson syndrome. So this is a triad which include microstatic hypochromic anemia, the atrophic glossitis, and the esophageal webs. So there may be congestive heart failure due to increased cardiac output as a anemia. There are central nervous system effects of iron deficiency anemia, which include the FICA, in which there is increased craving for non-nutrient material like clay and chalk. The patient have desire to eat the clay and the chalk, and there is increased craving for ice, for which a term is used which is called pagophagia. So it is specific to iron deficiency anemia. Now the physical finding include the angular stomatitis and glossitis, and chronic atrophic gastritis and chylomicria. So there are some enzymes which require iron for its synthesis. So if there is decreased iron, there will be decreased these enzymes, so which cause the epithelial changes. It will cause the angular stomatitis and glossitis, the chronic atrophic gastritis, and the chylomicria. Now going to the diagnosis of iron deficiency anemia. The first thing in diagnosis of iron deficiency anemia is to diagnose the anemia, whether there is anemia or not. So for diagnosing anemia, you should order CBC, which will measure the hemoglobin. In anemia, there will be decreased hemoglobin level. So the other test which required for diagnosing anemia is hematocrit and peg cell volume. So this should be decreased in anemia. Second step is to know the cause of the anemia. The first thing that you should order in second step is the MCV, mean corpuscular volume. The normal mean corpuscular volume is 80 to 100. So in iron deficiency anemia, it will be less than 80 femtoliter. The second test and second step is the peripheral smear. In peripheral smear, there will be microstatic hypochromic RBCs. In peripheral smear, the white blood cell and platelet will be normal. So the third step that are specific to iron deficiency anemia are the serum iron profile, which is also known as the iron study. So you should order serum iron, ferritin, and transferrin receptor saturation. In iron deficiency anemia, the serum iron will be decreased, ferritin level will be decreased, and transferrin receptor saturation will also be decreased. While the thing which are increase in iron deficiency anemia is the total iron binding capacity will be increases, the brain receptor will be increases, and red cell protoporphyrin will also be increases. Now going to the treatment of iron deficiency anemia. Thing is to treat the underlying cause. For example, if the underlying cause is decreased intake, then you should to increase the intake of iron, and if the underlying cause is the defective absorption, then you should to treat the cause accordingly. So the first thing in treating the iron deficiency anemia is to treat the underlying cause. The second thing in treating the iron deficiency anemia is to take the iron in tablet form. The iron in tablet form include the ferrous sulfate, the ferrous fumarate, other include the methyl folate. So these are the various tablet which include the iron. So this was all about on iron deficiency anemia. For more videos, subscribe, like and share.